provisions in the revised ASB guidelines on disaster response. Disasters can affect any shelter, regardless of location, facility, or resources. That disaster could be a natural disaster like an earthquake or a wildfire, or man-made like a hoarding situation. The disaster's impacts may be localized to the shelter itself, the community it serves, or an entire region or country. And of course, shelters outside of the impacted area may choose to respond when other agencies are facing disasters. For all of these reasons, any shelter can be affected, and it's important for shelters to be aware of and able to respond to a disaster that could impact them, their community, or a partnering organization when the need arises. So before we dive in, I want to emphasize that this additional section doesn't mean it's the only portion of the guidelines relevant to disasters. The rest of the document still applies because the animal welfare needs described in the guidelines are still present even when a shelter is experiencing a disaster. Deviations from these guidelines that occur as a result of the disaster should be as brief and minimal as possible. And this is where planning comes in. Good planning helps ensure that these standards can be met under any circumstance, and it's critical to safeguard animal health and welfare. Emergency management is a cycle divided into 4 phases that communities continually transition through. And this section of the guidelines outlines the recommendations for shelters walking through these 4 phases. The first is mitigation, the ongoing preemptive activities that reduce the impacts of future disasters. The next is preparedness, creating plans to handle specific disasters, conducting training or exercises or drills, and identifying and acquiring the resources that will be needed to respond. Response is implementation and adaptation, implementing the plan and adjusting as necessary during the event. And finally, recovery refers to the period following a disaster that lasts until the shelter and community return to some degree of normalcy. So starting with mitigation, shelters should take steps to anticipate, detect, and mitigate the impacts of disasters. This starts with identifying the events most likely to affect a particular shelter and community, and should include those disasters that may be more likely due to geography, such as a hurricane, as well as those disasters that can impact shelters anywhere, like workplace violence or a building fire. Shelters must identify and plan for reasonably anticipated disasters. Once the risks are identified, mitigation strategies can reduce the impact of a future occurrence. For example, community outreach to share information with the public on how they can evacuate with their pets could lead to fewer animals requiring rescue. Another example would be investing in shelter buildings that are appropriate for local weather conditions to minimize potential damage. For preparedness, every sheltering organization must have a written plan that outlines the actions the shelter will take in response to likely emergency scenarios. This written plan should be accessible to all personnel, staff and volunteers, and used to train individuals during disaster drills. It also needs to be regularly reviewed and updated. Some key aspects of these plans include laying out the detail regarding how shelters will provide essential services for all animals in their care, including those in foster homes, how the shelter will acquire the necessary supplies, and including an evacuation strategy in the event that the supply chain or utilities are disrupted. These emergency plans should include a process for preemptively relocating the shelter's population in advance of the event when that's appropriate. This is because evacuation ensures the safety of the relocated animals, and importantly, it can create capacity to provide housing and care for animals that may become displaced within the community. Even if minimal animal intake from the community is expected, that preemptive transport can reduce the impact of facility damage or challenges with delivering animal care when personnel may not be available. Because the risk of zoonotic disease spread may increase during disasters, plans must also include steps to control transmission. And the plan should indicate the personnel structure that will be necessary to provide that essential animal care service during the disaster. This will include identifying the critical personnel required and how the shelter plans to fill these roles, recognizing that that plan will of course come with a need for flexibility, as animal care needs or even the availability of personnel may be different than what had been anticipated. Training is absolutely an essential part of preparedness. It's critical for personnel to know what to do and when. And training specific to the roles that individuals will fill during a disaster, including the relevant safety considerations, should be provided before starting the work. Another key consideration is that shelters responding to disasters as part of a coordinated response should draft MOUs, Memoranda of Understanding, with response partners. Now we'll shift to response. The response plan should be followed as soon as a disaster is anticipated or has occurred. And that's because prompt response ensures critical sheltering and community needs are addressed as quickly as possible. The most common challenge faced during a response is communication, both internal and external communication. When indicated, an ICS or Incident Command System should be initiated rapidly to designate and maintain a clear chain of command and to provide for that communication infrastructure. On this slide here, you can see an example of what an ICS could look like for a response involving an animal shelter. This is included directly in the guidelines. Here are 4 important aspects for shelters to consider during their response. This includes resource management, intake procedures, reunification, and how to manage displaced animals. For resource management, shelters should have a system for managing physical and monetary donations during disaster response and recovery. And this includes a system for tracking staff time and a plan for how to address self-deployed volunteers. With respect to intake procedures, each animal admitted during a disaster must receive at least a cursory assessment at intake to check for signs of infectious disease, for any conditions that require emergency medical care, and to assess for exposure to hazards. Core vaccines and parasite control are key. I'll just highlight here that a core vaccination in disaster response includes rabies vaccination, which is a slightly different and intentional distinction to the recommendation that's included in the medical health section regarding general shelter intake. Additionally, decontamination procedures must occur when indicated, which could be in a variety of situations. As soon as it's safe, shelters must make concerted efforts to reunify pets displaced by a disaster. Animal holding times and communication with owners may need to be broadened or otherwise adjusted to reflect the challenges of a particular disaster. And we know that once animals are transported out of an impacted area, reunification becomes very challenging. And it's for this reason that reunification efforts need to be prioritized by those shelters performing the initial intake or those transferring animals very shortly after intake. Which leads us to displaced animals. Shelters outside of the disaster area accepting impacted animals must be able to provide appropriate care and outcomes for their existing population before volunteering to accept displaced animals. And finally, recovery. This can be a protracted period of time for a shelter and a community to return to normal. Even if undamaged, shelters may be challenged by continuing impacts on their community or their personnel. A few key points to highlight. If damage to the shelter buildings, grounds, or local infrastructure is of concern, a full safety assessment must be made prior to resuming normal activities. Shelters must tailor placement efforts when their community is impacted by a disaster. And shelters should provide additional services that support keeping pets with their owners in the time frame immediately following a disaster. Following a disaster, shelters should debrief and evaluate their planning, response, and recovery processes so that adjustments to the plans can be made. This is a natural time to broadly evaluate the effectiveness of programs, services, and procedures within the organization. And there may be changes that were implemented during the response that are worth keeping moving forward. By helping their community prepare, by responding quickly and effectively, and by planning for recovery both within the shelter and the surrounding community, shelters can strengthen bonds with the people they serve, keep pets with their families, and lessen the impact of even the worst disasters. Thank you.
Hello, I'm Uri Donnet, one of the authors of the newest editions of the ASV Guidelines for